A patient today asked about utilizing gabapentin for difficulty with anxiety towards the end of the night and actually for difficulty with insomnia. Gabapentin or Neurontin is not FDA approved for anxiety or for insomnia. With that being said, gabapentin does increase concentrations of GABA in the central nervous system, which is your major neurotransmitter, inhibitory neurotransmitter, so calming down neurons, and it may result in a lower subjective feeling of anxiety, and it may make someone a little bit tired and help them to fall asleep. This medication does have abuse potential, and so it's important to only take under the direction of a medical provider. With that being said, there will be times where I may prefer gabapentin over your traditional anxiolytics like clonazepam or klonopin, xanax or alprazolam, ativan or lorazepam, valium or diazepam, because I believe that it actually has less abuse potential than many of those medications. But again, with that said, I absolutely have had patients who have abused this medication and where once they've started it, they said, you know what, I think I like this medication a little bit too much, and then we've moved away from it because we were concerned that they were developing the potential to abuse it or to become physiologically dependent on this medication. Sometimes I'll use this medication for patients, with all that being said, to treat or to help with anxiety during the day or to help with insomnia. There's a pretty wide range of doses that can be used with this medication. For whatever reason, some individuals will take a dose like a 300 milligram pill and they'll feel extremely tired or extremely sedated. It may take them time to adjust to the medication or get used to the medication if they're using it for sleep or if they're using it during the day. And then for certain pain conditions, it's actually approved up to 1,200 milligrams 3 times a day. And so with that in mind, I'll have some patients say, you know, if I take 300 or 600 milligrams, I really don't feel much at all. It doesn't make me tired, doesn't decrease my anxiety. And we may increase higher to 900 milligrams or 1,200 milligrams for a dose. But all this needs to be done under the direct supervision of a medical provider. And it is helpful for the providers out there to know that this medication does come in capsule and pill forms anywhere from 100 milligrams to 800 milligrams. And so there's a pretty wide variation of pills available if you need to use different doses for different patients. If you believe this video pertains to you in any way, please be sure to speak to a mental health or medical professional directly. This video is meant to be informative only and not medical advice for anyone out there.